Greetings, humans and non humans alike, if you're watching. Welcome to the Dr. J vlog series. It's Thursday, January 16th, 2025. On Thursdays, we deal with knowledge and science. Today, we're going to be doing a deep dive into what I'm sure we all hope will be a once in a lifetime pandemic. And more specifically, what explains population differences in COVID 19 deaths, especially between the United States and Canada? So we begin with a reminder that the coronavirus outbreak started in Wuhan, China back in December 2019. By March of 2020, the World Health Organization had declared a global pandemic, and that remained in effect until May of 2023. In total, more than 7 million confirmed deaths have been linked to the COVID-19 virus. That, of course, pales in comparison with the tens of millions of lives lost. Some estimate as perhaps as many as 50 million people died as a result of the great influenza pandemic from 1918 to 1920. Now, that is 7 million is a huge number, nevertheless. And among other factors, modern medicine and the rapid development of an effective vaccine helped stave off the worst case scenario. Now, the research shows that there are a great many factors that influence the spread of COVID 19, including government prevention and control policies, socioeconomic differences, population mobility and concentration differences, a range of other environmental conditions, and still other factors as well. All of this type of information can be modeled on the basis of empirical data and computer simulations, through which we have a much better understanding of the underlying causes behind the pandemic's emergence and spread, outbreak, and eventual decline. So for today's Chautauqua, we're doing a deep dive into what happened specifically in the United States and Canada to examine what explains the COVID-19 mortality rates and the differences therein. Now, full disclosure, the US and Canada are my two countries, having spent my first 30 years growing up in the United States and my 32 years since then living in Canada. So I mentioned before I can speak both languages fluently, both Canadian, and American. But seriously, the two countries are quite similar in certain respects. We share the world's longest unprotected border. We're both considered to be affluent Western democracies with high standards of living and qualities of life. We are each other's largest trading partners, friends with economic benefits, to say the least. We also cooperate extensively in terms of military defense, shared intelligence, and law enforcement, and even space travel. And we have huge rates of annual exchanges and travel between the two countries. Sometimes it almost feels like Canada's the 51st state of the US. Sorry, all kidding aside. We do have an extremely porous border. Americans and Canadians alike love to crisscross the 49th parallel to shop, to vacation, visit family, and so on. We are, again, perhaps each other's best friends. And I, for one, have loved traveling throughout the vast expanses of both lands over the several decades I've lived. There's such geographic diversity, stunning landscapes, natural environments, and the diversity of local communities. There's such deep beauty and serenity, at least in my experience, embedded in both countries, from the spectacular landscapes to the many brilliant and resourceful people who are scattered across the diverse landscapes. And while there are special benefits to living almost anywhere on the planet, I certainly have a personal bias in that I've long felt privileged to have spent essentially my entire life living in either the US or Canada. And then having the luxury, of course, to travel to other parts of the world as well. So, but as much as we have in common, there are some interesting differences too, especially in terms of population health. The infant mortality rate, for example, continues to be lower in Canada as compared with the United States. We also know that Canadians on average live about 5 years longer than their US counterparts. But what I found most interesting here would be the differences in the confirmed deaths and the different mortality rates due to COVID-19 in both countries. Obviously, in the months that followed the outbreak of COVID, the declaration of the pandemic, there were sheltering in place and mask mandates and accelerated programs to develop effective vaccines and so forth. And while the death toll was significant in both countries, the pandemic was significantly harsher, or at least the effects thereof, in the United States in 2020 and 21 compared to Canada. And so I'd like to try to explore why that's the case, or why that was the case. So here's the issue that's really perplexed me. For the calendar year 2021, and again, I'm just looking at 2021 specifically, the population-based mortality rates for COVID-19 was about 39 per 100,000, 39 deaths per 100,000 Canadians, and roughly 124 deaths per 100,000 population in in the United States. The CDC on the low end has estimated that to be perhaps 112 deaths per 100,000. Regardless, COVID 19 was the second leading cause of death in the United States in 2021, and the fourth leading cause in Canada. All right. Um, Now, to be clear though, understand that those differences, or what we mean by the death rates from COVID, can mean different things. All right. So, in particular, you can be talking about survival and death rates in terms of what happens to people once they've contracted the disease. All right. And in that regard, Johns Hopkins estimates that in both countries, about 1.1% of the population died if they contracted the disease. Highly comparable, no statistically significant difference to say the least. The problem is that only about 11 uh, percent of Canadians who contracted the disease in the first place, whereas over 30% of US citizens contracted COVID 19. Now you could say, well, wait a minute, there's a lot of comorbidity here too, right? In terms of deaths. It isn't just COVID 19, that's often linked to other conditions or pre existing conditions. You're absolutely right. That's 100% true. And so some want to claim that, well, so you're overstating the cause of death from COVID 19. And that could be true to a certain degree, right? Especially since other diseases, other pre existing conditions could be influencing and do influence people's health trajectories. Some people were going to die regardless, and COVID 19 may have sped things up. But the point is that those effects are present in both countries, okay? And yet the Canadian rate was still significantly lower than that of the US. Um, and so the logic applies equally to both countries. We have similar assessment strategies, similar measurement strategies, and the data still indicate far greater success in terms of public health and lower COVID mortality rates, at least twice, perhaps 2.5 times better in Canada compared to the US. And in the end, roughly 1.2 million US citizens lost their lives compared to 61,000 Canadians. So, what explains that difference? Well, in 2020, Canada developed and implemented a more stringent set of public health measures, which included larger and stricter stay at home measures, restaurant and school closures, fitness facility closures, and other businesses, as well as curfews and limits on public gatherings. Now, the US started along that pathway as well, but not as quickly and not as comprehensively. So most experts believe that that's one factor. There were also differences in the vaccination rates between the US and Canada. Now, interestingly, the US took an early lead in that regard. In fact, by once they developed an effective vaccine, by April 1st of 2021, more than 20% of Americans had been fully vaccinated, compared to only 2% of Canadians. However, by October, those numbers had flipped dramatically. By October of 2021, fully 75%, I think 76% of Canadians were fully vaccinated against COVID, compared to only 58% of Americans. And that reflects, too, in part, another issue which I'll talk about in a moment, which is the higher level of Canadian trust in their government than in the US, at least according to survey data, public opinion polling. And indeed, vaccine resistance took root much more deeply in the United States than in Canada. Consider, too, that the Canada has a system of universal publicly funded healthcare, and that has long ensured greater access and more affordable healthcare than compared to the US. Now, again, don't get me wrong. Whatever flaws persist, and there are certainly flaws within the Canadian system too, the fact remains that almost no one worries in Canada about how much healthcare will cost them or out of pocket costs. And most Canadians readily take advantage of the universal healthcare system in terms of basic checkups, in terms of managing basic health concerns or needs, and without worrying about finances or worrying about, going bankrupt in general. Now, in the US, of course, you can have access to the greatest healthcare anywhere on the planet. And many do have such access, which is great. Okay. That has a direct effect, by the way, in terms of survival rates, which I'll get to in a moment. But at the same time, there are millions of Americans who are not insured, who have no health coverage, or have greater hesitation in even thinking about going to the doctor or seeking access to primary care because of concerns about cost and or being denied coverage, that sort of thing. So that's a real concern. Um, but the pandemic, I would argue, also revealed certain other fault lines in comparing US and Canadian societies and institutions. So, for example, there are measurably, as I mentioned a moment ago, measurably higher levels of distrust of the government in the US as compared with Canada. There are also, empirically, higher rates of poverty and income inequality in the US compared to Canada. And again, that disproportionately affects you in terms of your access to health care. There are as well ethno-racial divisions that continue to persist even in the 21st century. And you could argue ideologically there's higher support for individualism and libertarianism. Now, why would any of that even matter? Well, more Americans subscribe to powerful libertarian strands and thinking. And if that's buttressed by the right wing media machine, which tends to be, then that has led to views that masks were a violation of freedom, and that vaccines were even a form of government tyranny or mind control. Now, Canada had some resistance as well with complying to mask restrictions. There was the trucker convoy that helped shut down the government for a week. So that's one example of resistance. But overall, there was much greater support for the Canadian mandate and the imposition of the varying rules with respect to how to cope with the public pandemic. And so when the Omicron variant hit and then peaked in January of 2022, so just after the time I'm talking about, by then 80%, or at that time, 80% of Canadians continued to abide by the publicly mandated mask mandates. And that compares with only about 50% of Americans. And I can tell you too that the airwaves in Canada were not dominated by anti mask and anti vaccine rhetoric, but rather by public service announcements one of which I'll share with you in just a moment. And so I found that to be, in the Canadian context, I found that to be extremely calming and easier to follow and to rally around, as opposed to a more alarmist, or at least uh, an inconsistent messaging system in the United States. And I also think that size matters. The sheer population sizes have an effect. It's easier to reach 40 million Canadians, right? And get them kind of all on the same page, I think, as compared with 340 million Americans. So, but then there were messaging issues and flaws, as I like to discuss. And that shines through in part in terms of what the political leadership might emphasize in communicating with these huge publics. So here we see a real difference, I think. In Canada, we had the Prime Minister, Justin Trudeau, who you probably know, stepping down. But he stated back in March of 2020, quote, I'm going to make sure that we continue to follow all the recommendations of public health officers, particularly around stay at home mandates whenever possible and self isolation and social distancing, end quote. So this message was then reinforced by Dr. Theresa Tam, who's Canada's chief public health officer, who in March delivered a message urging solidarity, declaring, quote, we need to act now and act together. And here's a specific example of what I'm talking about, or what she was talking about.
Globally, there are now over 175,000 COVID-19 cases in over 160 countries. There continues to be a concerning increase in cases reported in Canada in the last few days. As of right now, we have 407 cases of COVID-19 in Canada. All 10 provinces have now reported cases. We also have 8 confirmed cases among the passengers repatriated from the Grand Princess, who are all quarantined at CFB Trenton. Canada has tested nearly 34,000 individuals to date. Internationally, Europe is the epicenter of the outbreak. We ask that all travelers coming to Canada self-isolate for 14 days after arrival. These efforts will contribute to slowing the introduction and spread of COVID-19 in Canada. At the same time, the continued global movement of goods and people and the ongoing delivery of essential services will be important for Canada's response to COVID-19. Consequently, an exemption to the request for self-isolation for 14 days should be provided to workers who are essential to the movement of these goods and people. All Canadians must act now to take all precautions and practice social distancing in order to interrupt chains of transmission, to delay and suppress the epidemic curve of COVID-19. Most of Canada's cases continue to be travel-related, so public health authorities across Canada are continuing with strong efforts to detect cases, trace, and manage contacts. COVID-19 is a serious public health threat. This disease and this outbreak will disrupt our lives. For many of us, that may mean we are ill or our family members are ill, or that work, social functions, childcare, and other aspects of our lives are disrupted. But for some, the disease will be much worse, severe, and life-threatening. We all need to take every precaution to protect older adults and medically vulnerable people who are at greatest risk of severe COVID-19 disease. Those of us within Canada are urged to postpone or cancel travel outside of Canada unless it's essential. To increase your personal physical space from others, public gatherings of 50 people or more is to be avoided. Where flexible work arrangements are possible, consider contingencies like working from home if this becomes necessary. And most importantly, if you do develop symptoms, no matter how mild, stay home and follow the instructions of your local health authorities. Doing this will keep protecting others around you and very likely save a life by limiting the spread of this disease.
Okay, so uh, Shift this back here, shift this back over. So a pretty powerful message, to say the least. And Canadians abided, by and large, by the messaging and followed the directions. Now, the U.S. had a more mixed message in response, especially early on, especially with respect to COVID. And so, the president at the time, President Trump, declared, for example, that he wouldn't be wearing a mask. That, quote, I don't think I'll be doing it. I just don't see it, end quote. And instead of reinforcing the messages of Dr. Anthony Fauci, the chief medical officer heading up the president's coronavirus task force, unfortunately, Fauci's statements early on were more tepid than Tam's in Canada, and he and the CDC changed their recommendations later on, which fueled, doubts and mistrust as well. And then Trump, though, undermined the orders to some degree as well by stating, for example, with respect to stay at home orders, quote, I think elements of what they've done are just too tough, end quote. And of course, he also suggested certain cures to COVID-19, like at one point, for example, suggesting that we should ingest, or you might consider at least ingesting bleach or taking hydrochloroquine. Hydroxychloroquine. Um, well, and then there's another example of messaging that you might not recall, but there's this guy named Elon Musk, a brilliant, industrial tech entrepreneur. Perhaps you've heard of him. So, unfortunately, early on in the pandemic, he started to spread false information on Twitter, which he, of course, eventually purchased in October of 2022 and renamed X, and across other media platforms as well. And he was downplaying the seriousness of the situation. So on March 6th, 2020, for example, he tweeted dismissively, quote, the coronavirus panic is dumb, end quote. Right? Now, to his credit, he was willing to put his money where his mouth was. And so he decided to challenge his friend at the time, good friend Sam Harris, to a bet because they had different views about what would happen with the coronavirus. And so Elon bet Sam Harris $1 million to be given to charity from his side against a bottle of fancy tequila for $1,000 on Sam's side. That we wouldn't see as many as 35,000 cases of COVID in the United States when all is said and done. That is cases, not deaths. Okay? And so the terms of the bet, that is Musk's $1 million compared to Harris's $1,000 bottle of tequila, reflected Musk's estimation and the near certainty of the 1,000 to 1 ratio, the 1,000 to 1 odds that he was right and that Harris was wrong. Right? Again, he didn't think there would be 35,000 total cases from COVID, regardless of how many deaths ultimately. Well, the next month, literally the next month, April of 2020, the CDC reported more than 65,000 actual deaths from COVID. So he was wildly off base. And I'll talk another time about the limits of what anyone can know, the importance of expertise in selected fields, and the problems of confirmation and selection bias, as well as personal bias, magical thinking, even at times for the rich and powerful, some forms, and even some scientists for that matter, some forms of egotistical and megalomaniacal thinking. And again, that's a different story for a different day. For now, I want to suggest too that the pandemic highlighted another readily measurable and empirically verifiable difference between the two countries. That is to say, that Americans on average are less healthy than Canadians. So they have more pre existing medical conditions that would have made them more susceptible to deaths from COVID in the first place. So, for example, the fact that 42% of Americans are defined as obese compared to 27% of Canadians. Other health conditions, such as diabetes and even heart disease, afflict proportionally much higher rates of Americans than Canadians. Now, I'm not happy about that. I'm not bragging about that. These are statistical facts, and they have direct implications for mortality rates. So, by the way, this doesn't matter whether you're comparing the US to Canada or any other country in the world. The science with respect to COVID took a little while, but started to round into shape. And there were certainly some false starts in the pandemic along the way. But as the information improved, it seems to me that Canada was able to sort of rally the troops and respond a little more effectively than in the United States. And as we face real public health challenges, we have to consider the fact that under no circumstances can we ever have full or perfect information. But of course, the public health officials have to tell people something, have to provide some direction, as do the politicians. So we all have a kind of shared responsibility to do the best we can at any given moment in time, right? So that's one issue. And then the parallel issue in that regard is the unfettered access to information that allows anyone and everyone to post whatever information they might like so that anybody can claim to be an expert on a subject matter, to claim to have done their research, and to share what they know on the internet or, again, different social media platforms, and to claim to somehow know better than the experts, than those who've spent their lives devoted to working on these issues. And at times, in the worst cases, of course, to support the conspiracies or dissemination of patently false or ridiculous information or claims of any kind that they like, even if they know that they're absolute lies or falsehoods. So, in closing, pandemics and public health crises don't care about politics or who's in office or anyone's political views. So instead, I hold the view that intelligent people who invest time and energy can learn from these investments, learn from others, learn from their own mistakes. But we also have to be willing to respond to the complexity of a diverse set of circumstances. And in some cases, we'll have to be more nuanced in targeting our responses to the pandemics, okay? Both in Canada and the US. What do I mean? Well, again, adjusting our strategies, for example, to target the most high risk populations or demographic groups right from the outset, rather than treating everyone as equally at risk, or putting in place, in some cases, stricter regulations for high density areas, or relaxing conditions in other parts of the country. It's difficult to do because everyone wants to be quote unquote treated the same laws, same conditions. But the environmental conditions vary too, so one has to try to factor that into the equation. Well, regardless of what the ultimate decisions might be, I'd encourage all of us to continually invest in learning from our experiences and ideally being more proactive with respect to improving general health and well being, and hopefully then to be more prepared for the next pandemic that might be just around the corner, but could be 50 or 100 years away for all we know. For even if we're talking about that once in a century pandemic, what's the harm, in my view, of working actively to expand healthcare and access, to promote health practices across the population, to do things like reduce obesity, improve diets, and take other actions aimed at improving general population health and well being. All right, that's my perspective, at least in brief. And so thanks for listening. And as ever, may you and yours continue to create peace in your lives and nurture love in your hearts. And I hope to see you again tomorrow. Bye bye.